morning I'm going to do an oral care, so always I want to check the patient's charts, make sure I gather the necessary things that I need to take in with me. I'm going to wash my hands before I enter the patient's room, also introduce myself and check the patient's ID band, wash my hands before I help assist the patient. So I'm going to apply the appropriate PPE. So I'm always going to wear gloves when I do this, and sometimes if I feel necessary, I'll wear a mask or even goggles if I feel like maybe something might get splashed with certain patients. So then when I'm ready, I always want to check everything. I'm going to check where the placement of our endotracheal tube is. So I always want to make sure I notice where the number is, make sure it's in the proper placing for that patient. And also we can also listen to see how the cuff, where the cuff is and how it sounds. So when we're ready to go, after everything, we got the vital signs and everything done. So we're gonna go ahead and get our section kit and everything prepared to go. So we have this, and we're gonna connect it to our suction here, and we're gonna have another tubing that goes along, and then we are gonna connect an anchor to the suction. So we always want to turn on our suction to a -100 to -120. Don't ever exceed that. So always with a patient, sometimes endotracheal tubes have a little device that holds the endotracheal tube, but it's also able to move side to side. So when you're ready, you always want to make sure your suction works. You'll be able to hear it, a little hissing sound, and you can also hear it when you test it out. But before you turn it on, so you want to move your protection sheath back. And so then you're going to go ahead and turn it on. So you're going to get the inside of their cheeks, on the side of the cheeks, kind of in the back of the mouth. But you don't want to hit their gag reflex, so that way it doesn't initiate anything like that. So when you're done, always shut it off. And then you, when you're ready, you would remove this and set it off to the side. And you would get ready to do your suction swab. So you always want to make sure you clean out their mouth with these solutions every 2 hours, so that way the patient does not get any sores, doesn't develop anything that can be induced from having the endotracheal tube in and being intubated. So always you want to go ahead and get it ready. So you're going to connect it to your suction. And so you're going to have it like that. And so you don't have to have your suction on for this one right away. So what you're going to do is you're going to take your liquid here. So this is going to be your cleaning kit. So you're going to dip it in there. And so what you're going to do is go inside the cheeks and be in front of the lips there, right next to the gums, their tongue, and then on the top of their mouth. You want to make sure those are nice and clean. And so always then, if you have any excess, then you can turn on your suction catheter then, and you'd suction and clean out everything, any excess out of their mouth. Now, if you see anything before you go do the moisturizer and everything, you may have to suction out again. So you just get your yanker out, and then you just suction that again. So when you're done with that, dispose of it. And then you would go ahead and grab out your moisturizer. So you're going to open this up, and you're going to put it out on one side, and then you're going to use this, and you're going to go ahead and use this to spread it out evenly, so that way you don't have big clumps that can get back into their throat or anything like that when you're suctioning. So when you're done, so with that, so what you're going to do is you're going to moisturize the side of the mouth, the side of the cheeks there, make sure everything, the tongue, everything is nice and moisturized, because when they're on ventilations, a lot of times their mouth gets dry, and also their lips. So you always want to make sure you get their lips and everything, because that can get dried out. So when you're done with that, so then you'll come back after 2 hours. So then you would suction anything that you may need to suction. So the next one would be your toothbrush. And so you're going to get everything ready. You're going to get your solutions out. And then you're going to take out your toothbrush for the patient. And then you're going to connect it to your catheter like that. Or, excuse me, not catheter, but your suction deal. And so then you're going to take it and put it into the solution. So when you're doing the teeth, you don't have to have the suction on. So you're going to go ahead and do a circular motion. Make sure you get all the teeth behind the teeth. Make sure that way they're nice and clean. Nothing gets built up on them while they're here in our care. So when you're done with this, always remove this. and dispose of it. And so then the next thing that you do is you do your moisturizer again. So you go ahead and put it on, and then you spread it out. And again, do it on the cheeks, inside of the cheeks. Make sure nothing gets dry, their tongue, and then also their both lips. Make sure it's nice and moisturized. And so once you're done with that, dispose of that. Then you come back again after 2 hours, and then you go ahead and do your suction cath. So this one, you're gonna go ahead and connect it to here. So this one, you don't have to have the sterile gloves, but try to keep it as clean as possible, especially when you're sticking it in their mouth to suction everything. So when you're ready, you can always turn it on to test it to make sure it's working properly. And so what you're gonna do is suction around the mouth, make sure everything is good, and you're kind of gonna be careful, like to try to suction the back of the mouth and try to get close as you can to make sure there's nothing built up, especially above the cuff or anything like that. So when you're done, you'd shut it off, dispose of your catheter, and then you would always double check through their mouth and make sure everything's good. If they need another suctioning, then you go ahead and use your anchor suctioning. So when you're done, always recheck the patient, make sure the placement of the endotracheal tube is in the correct position. Make sure you have it to where it's in a good position for them. And also you want to listen to their lungs, everything, get their post-vital signs, especially after you've suctioned them. And then always dispose of everything, remove any PPE that you're wearing, wash your hands before you before you leave the room, and then you also want to chart after you do an oral care.